Okay, so we got Dan the Man Hernandez here getting a chiropractic adjustment. Okay, pelvis is a little bit off, but it's not bad. When did I last see you, Dan? Was it a couple weeks ago, a month ago?
Yeah.
A month ago, okay. So we see him on average about once a month, sometimes less, it just depends. So here, you see this? See how trying to close his legs or bring the heel to the buttock? And you see here, when I do that, the right one, this one over here, doesn't bend as far. So you could see that right there. So we've got a little bit of tension in his right quad. So that tells me probably his right pelvis is pulled back. And as I palpate, I look for that, and I look for it to be lower on one side. Sure enough, it is. So we're going to adjust that right pelvis as if it went posterior and inferior. So let's have you lay on this side. See, I just gave you one of my nuggets there. Don't try this at home. I can't adjust myself. You definitely can't adjust yourself. I wish I could adjust myself sometimes. And for those of you asking how often I see a chiropractor, I'm going to see my chiropractor today, but I see a chiropractor usually about once a month. Although I had a bike accident last year, so this year I would say it was more than once a month. Just trying to rehab and get back to where I was, back to Ironman shape. So take a deep breath in and blow all the way out. Good. And the other side up. So Dan, how's it going with the piloting stuff?
It's going good. This summer I'm going to take a whole week of just those classes, and I get my first license.
Okay, nice. So he's working on getting his pilot's license. So if you ever see or hear Dan the Man on the loudspeaker on your flight in the future, stop in and say hello to him.
Hopefully not yelling Mayday, Mayday, Mayday.
Yeah. And don't barge the cockpit. Relax yourself here. Relax. Yeah. Take a deep breath in. So we're just going to take this hip to extension. Good. And blow all the way out. Excellent. And lay on your stomach. So being a pilot takes how many hours?
To get all the licenses, 250.
250 hours of flying. Okay. Well, that's good to know. They're well trained. So we just corrected that pelvic misalignment, and I'm sure he feels the difference already just laying there flat. Less pressure on the low back. You didn't have back pain, did you?
Today, no.
Okay. Now, he has a little bit of sensitivity right in there. You feel that?
Yeah.
Okay. And here. And so what would require somebody that's been, having maintenance care for 11 years to continue to need it? Well, our spines, there's all these movable joints at each level. And unfortunately, many of us have bad posture, or we sit at a desk all day, which is you, right?
Yeah.
You sit now. He didn't always do that. But a lot of it has to do with the daily activities, the things that you're doing on a day-to-day that are aggravating either your neck or your back. So either stop doing them, fix how you do them more ergonomically. And there are all sorts of resources online for that. And for desk workers, there's definitely resources. In fact, our website at synergywellnessny.com, you can click on corporate wellness and you can take a ergonomics assessment test and evaluation to see how your ergonomics are. Do it from your computer, the computer that you work in, or go to your office and go on to our website, synergywellnessny.com, and try that. And that's a good resource to get you started. So we're going to take some of that rotation out of his spine, and you feel this right here?
Yes, sir.
Now, it's not nearly as bad as it used to be. And we're going to x-ray him and check on that all these years later. Relax yourself here. Good. Now, I take x-rays, but I'm not a big proponent of re-x-raying people. The only time we do that is in like severe cases of scoliosis that we're working on straightening. If a patient is coming in for scoliosis care, but they're not trying to straighten it, they're just managing the pain, then we don't follow up with x-rays a year or two later, because we know that we're not going to see some significant changes if they're just treating it when they have pain. We have other patients that actually 2-3 times a week for several months and down to twice a week, once a week, they do Schroth exercises, and they go through a whole year or two period or process and treatment plan. Those patients, we do re-x-ray. Go ahead and take a deep breath in and blow out. Good. And Dan's problem wasn't so much scoliosis as it was rotation in the spine for him. Okay, Dan, we're going to have you turn over on your back and cross your arms in front of you. This is an adjustment I end up doing for a lot of people that have neck issues. When you get pain in between your shoulder blades, oftentimes the vertebra, because people have their head down this way, and it's pulling. The paraspinal muscles are pulling on the mid-thoracic spine, and people get anteriors. So that's why I adjust with patients face up. Go ahead, tuck your chin, take a deep breath in, and blow all the way out. Good, and head back. Now, you haven't had any numbness in your arms, have you?
Not lately.
Have you had that anytime recently?
No. I did have it a few weeks ago. That's when I came by to see you.
Okay. Was that the first time in a long time that you had that?
First time in a long time.
Okay. What do you think you did to aggravate it?
Well, I've been training for a marathon that's coming up in 2 weeks.
Nice.
So I think that may have something to do with it.
Okay.
Yeah.
So I know while he's training, I know he runs with his orthotics, right?
Yeah.
Okay. Are those your running shoes?
These here? Yeah.
Yeah, okay. Relax here. Good. So just an upper cervical, a C1 adjustment there. C1 is the most freely movable vertebra in the spine, which is pretty incredible. When you think about that, it's very common for it to be subluxated or out of alignment. And relax here. And some of the symptoms, can be dizziness, vertigo, headaches, sinus pressure. What else? I'm missing something here. Pain in the eyes, behind the eyes, headaches behind the eyes or around the eyes, or in the occipital region back here. Those are just some of the common symptoms that can arise with a subluxation in that area in the very top of the neck at C1 or the atlas, the most freely movable vertebra. So everything feels really good there, Dan.
Thanks.
You're welcome. Have you had any numbness in the last 72 hours down the arm?
Everything's felt pretty good, Doc. So far. I can't complain too much. I just felt like the tightness on the upper back and the lower back.
Okay, on the upper back on the left side?
Yeah.
Okay. Go ahead, sit up, face the camera, and sit right here. So we're going to do a little ART to loosen up the trap and SCM muscle. Tilt your head to this side. Yep, and now pull away. Great. This is really effective, very effective stretch. And you can do this on your own. I've actually done a video on this as well. Go ahead and tilt. And away again. Yeah, this is a great stretch. I've done a short video on this under a minute and shows you how to stretch and how to alleviate neck pain, headaches, tension headaches, just with this simple stretch. So he would take his opposite hand instead of me doing it and helping him. How you doing there? Sensitive?
Yeah.
And the other side? Yeah. Good. And again. Great. Turn your head left and right. Okay.
Much more loose and relaxed.
Yeah. All right, great. So that's ART for you there. Be sure to check that video out if you get tension headaches or neck pain after you've been on the computer all day long. And this is just a follow-up visit here on a guy that's done wellness care and taken care of his spine so he ages gracefully. Are you going to age gracefully? I hope so. Thanks for tuning in. Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like and don't forget to subscribe. Appreciate you guys.